s'en viennent. Bonjour à tous. Hello everyone. Bienvenue à cette conférence de presse. Welcome to this press conference. Nous débuterons par une allocution du Premier ministre du Québec, M. François Legault, puis du ministre de l'Ontario, M. Doug Ford. Suivra ensuite les premiers ministres du Manitoba, M. Pallister, et de l'Alberta, M. Kenney. On procédera ensuite à une période de questions des journalistes présents ici, puis une période de questions de journalistes au téléphone. We will start with a declaration by Premier Legault from Quebec, followed by Premier Ford from Ontario. We'll then go to Premier Pallister from Manitoba and Premier Kenney from Alberta. We'll take questions from journalists present here today and from journalists on the phone. Monsieur Legault, à vous la parole.
Oui, bonjour tout le monde. Good afternoon, everyone. Je veux d'abord saluer les premiers ministres Ford, Kenney et Pallister. On est ici aujourd'hui à Ottawa pour exprimer, au nom de tous les premiers ministres des provinces et des territoires, nos demandes unanimes au gouvernement fédéral. D'abord, dans toutes les provinces, on a la même grande priorité, le financement des dépenses en santé. On est tous unis là-dessus. Le problème du financement des soins de santé est un problème qui existe depuis plusieurs années. Il s'est empiré cette année avec la COVID-19. Et si on veut être capable de continuer à offrir aux Québécois, aux Canadiens, des services de santé de qualité, il faut que le gouvernement fédéral fasse enfin sa juste part. Cette année, les provinces et territoires vont dépenser 188 milliards de dollars, plus de 188 milliards de dollars. Or, la contribution du gouvernement fédéral via le transfert canadien en santé est de seulement 42 milliards, donc 22% seulement des dépenses de santé sont financées par le gouvernement fédéral, donc 78% par les provinces et territoires. Et il faut comprendre que ce problème empire à chaque année. Pourquoi? Parce que quand on regarde les revenus et les dépenses des gouvernements, il y a une moyenne d'augmentation d'à peu près 3% des deux côtés. Donc, c'est gérable. Le problème, c'est qu'il y a une dépense qui est très différente des autres, la dépense en santé, qui augmente en moyenne de 6% par année. Parce qu'en plus que l'inflation, il y a les impacts du vieillissement de la population. Les personnes âgées consomment plus de services de santé que les personnes jeunes. En plus, à chaque année, heureusement, on découvre des nouveaux médicaments, des nouvelles technologies et, évidemment, ces nouvelles technologies, ces nouveaux médicaments coûtent cher. Donc, c'est pour ça, quand on regarde la moyenne, bien, on a une augmentation de 6% par année. Donc, il est temps que le gouvernement fédéral fasse sa juste part. Ce qu'on demande, c'est très raisonnable, c'est que le gouvernement fédéral passe d'une contribution de 22% des dépenses de santé à 35% des dépenses de santé. Donc, si on regarde les chiffres, ce qu'on demande, c'est que dès l'année prochaine, le transfert canadien en santé passe de 42 milliards à 70 milliards, donc une augmentation de 28 milliards. Ce qu'on demande pour les années suivantes, c'est que le gouvernement fédéral continue de financer 35% des dépenses de santé des provinces, des territoires. Et ce qu'on demande aussi, c'est que ce transfert soit fait sans condition. D'abord, on est dans un champ de compétences des provinces et des territoires. Ce sont les provinces et les territoires qui donnent ces services. Ce sont les provinces et les territoires qui sont les mieux placés pour choisir les priorités à l'intérieur du réseau de la santé. Ce qu'on demande aussi, c'est une rencontre avec le premier ministre, dès cet automne, avec le premier ministre canadien, pour discuter seulement de santé, de financement de la santé, pour avoir une entente à long terme qui pourrait être mise en place dès le prochain budget. Donc, dès le 1er avril prochain, d'être capable d'avoir une augmentation de 28 milliards de dollars récurrents ajustés par la suite. La deuxième demande qu'on fait, ça concerne le programme de stabilisation fiscale. Il y a des provinces, comme l'Alberta, qui ont souffert d'une baisse importante de leurs revenus et il doit y avoir un assouplissement, une aide particulière dans le programme de stabilisation fiscale. La troisième demande, ça concerne les infrastructures. Actuellement, les provinces, les territoires ont beaucoup d'infrastructures, qu'on pense juste, par exemple, au transport en commun, Internet haute vitesse. Pour vous donner un exemple, juste le Québec, on a un plan d'infrastructure pour les 10 prochaines années de 125 milliards. Donc, ce qu'on demande au gouvernement fédéral pour l'ensemble des provinces et territoires, c'est un nouveau programme de 10 milliards de dollars par année pendant 10 ans, donc 100 milliards sur 10 ans, pour les infrastructures. Donc, il est temps que le gouvernement fédéral fasse sa juste part. Et peut-être en conclusion, ce que je dirais, c'est qu'on a vu le gouvernement fédéral, au cours des 6 derniers mois, dépenser beaucoup, mais beaucoup des annonces qui ont été faites depuis 6 mois étaient des dépenses non récurrentes. Donc, il y a des dépenses comme la santé. Si on embauche des infirmières, si on embauche des préposés, bien évidemment, qu'est-ce qu'on fait l'année prochaine? Là, on a eu de l'aide du fédéral pour l'année 2021, mais qu'est-ce qu'on fait à partir de l'année 21-22? Donc, ça prend des contributions du gouvernement fédéral qui sont récurrentes. Donc, la semaine prochaine, il y a le discours du trône. Ce qu'on souhaite, c'est qu'avant que le premier ministre annonce des nouveaux programmes, des nouvelles dépenses, mais qu'on finance correctement les dépenses qui sont les priorités des Canadiens. So we're here on behalf of the premiers of all provinces and territories to call on the federal government to respond to the priorities and needs of all Canadians. First and most important, by contributing its fair share of health spending in the country, we ask the federal government to increase its share from 22% to 35%. Secondly, we ask the federal government to come to the aid of provinces having significant revenue decrease like Alberta by easing the federal stabilization program. Third and finally, we ask the federal government to increase its contribution to infrastructure investment. So what we're asking is a fair and equitable partnership with the federal government. Merci. Thank you.
Well, thank you so much, Premier Legault, and I'm very happy to be here with Premier Pallister and Premier Kenney, and we're able to put this meeting together relatively quickly. But speaking to all the premiers from all provinces and territories, and speaking on behalf of the Canadian public, all of us, the number one concern is healthcare right now. To put this into perspective for all Canadians, we are spending collectively with premiers right across this great country approximately $188 billion a year. Out of that $188 billion, the federal government is contributing $42 billion, roughly 20%, 21, 22%. So out of every single dollar, they're contributing one in five. And this is not a knock. I want to emphasize this. It's not a knock against one particular political stripe or party or government. This, folks, have been going on for decades. As the demand is increasing, as Premier Pallister, we're talking at lunch, as the demand is increasing, the support from the federal government has been going down. We have increases of approximately 5 to 6% year after year after year. Just think of it, folks. That's almost a $20 65% increase over a 5-year period. Ontario is spending $67 billion a year. Nothing right now is more important to Canadians than health care. Because without health care, we have nothing. If we don't have our health, we don't have an economy. And my friends, we're here to ask the federal government, step up to the plate. We need 35% funding. That's $70 billion. We've seen healthcare costs escalate overwhelmingly throughout this pandemic. No matter if it's backlogs on surgeries that Ontario is facing, over 180,000 backlogs throughout this pandemic. Long-term care, we need to look at capital spending as well. New hospitals, new long-term care, more staff. That's what we need, because no province, it doesn't matter if Ontario being the largest province or not, we can't sustain it. We have a system that is broken. When it comes to health care, we have the best doctors anywhere in the world. We have the best nurses, the best PSWs. These folks are the frontline heroes that have been working their backs off day in and day out throughout this whole pandemic. And even before the pandemic, they're working their backs off. But we need the support. We need the support to hire more nurses, to hire more PSWs, to get more doctors, to make sure we can keep a healthy system. You see the lineups that have happened in Ontario, and I can't speak for the rest of the provinces, but I'm sure it's happening. You've seen cases jump from 300 to over 400, just over a few days. We've seen the system go from under 100 cases, literally overnight, up to over 400. It's very concerning. We need the support from the federal government. We're asking the federal government support all Canadians. Be a true partner when it comes to health care. You've been a true partner throughout this pandemic with the Safe Restart program, and we appreciate it, and I thank you personally for that. Now we need your support for health care, because without that health care, the economy is not going to move. People need confidence that we have a strong health care system will mean a strong economy, and we'll all get through this together. So thank you. I appreciate all my colleagues and our colleagues that haven't been able to make it. It's not that they didn't want to make it, it's they couldn't make it for one reason or another, but we're speaking on behalf of all premiers right across this great country, from coast to coast to coast. So Premier Legault, thank you for calling this together, and I look forward to COF, and I look forward to the throne speech next week from the federal government. I can't be any more clear. We need your support. We're in desperate need of your support. Prime Minister Trudeau, Deputy Prime Minister Freeland, the whole caucus, we need your support. Your constituents need your support. The provinces and territories need your support. So thank you.
Il est important que dans le prochain discours de trône, le gouvernement fédéral fasse de l'essentiel l'essentiel. Et l'essentiel, ce sont les soins de santé. You want a recipe for problems, you have it. Growing demand for services, a decreasing federal partnership contribution equals longer waits for care. That's a formula none of us want to see, but it's a formula that is real, and it's a formula that's been exacerbated as a consequence of COVID-19. Okay, you've heard the speech before from me, but let's talk about the impact really on people. Right now, millions of Canadians are waiting for an appointment, for a test, for consequential treatment, for surgery. Those delays are painful. A lump that isn't diagnosed is not fun. Every single day, right now in Canada, there are people who fear directly the consequences of delay. And their families join in that fear. And their friends join in that fear. There is no easy way to say this. This has been a problem of long standing. We've raised it before. It has been unaddressed. It needs to be addressed now. What we're asking the federal government to do is to step up and resume its rightful role as a Medicare funding partner with the premiers of this country, so that we can give Canadians the assurance that they deserve to have, that care will be there for them in a timely manner when they need it. This is the key. This throne speech needs to focus. I know that is difficult for any government. It is especially difficult for minority governments. But they must focus and keep the main thing the main thing. And the main thing is the personal health and well-being of each and every Canadian.
Jason.
Merci, François. I'm proud to be here on behalf of Albertans to join with my colleagues from across the country to call for fiscal fairness in the Federation. Fiscal fairness on health care. Provincial taxpayers are carrying nearly 80% of the burden in a system that becomes more costly as our population ages. And that is more clear now than ever in the midst of the worst public health crisis in a century. We all say during COVID that we need to be all in this together. And while we do appreciate many of the recent actions of the Government of Canada, fundamentally, as my colleagues have pointed out, our ability at the provincial level to pay for the quality of care that people rightfully need and expect is increasingly limited in a bargain that was supposed to be a 50-50 federal-provincial share of health care costs when Medicare was formalized as a national priority 5 decades ago. And so I'm here to join my colleagues in making that very clear united call on behalf of Canadians. This shouldn't be seen as a federal-provincial dispute, squabbling between governments. Not about politics, it's about people. And this is more desperate in Alberta than perhaps anywhere else, given the fiscal calamity that we are facing after 5 years of economic decline and stagnation, on top of which we are now experiencing both the biggest contraction in the global economy since the 1930s and the largest decline in energy prices in history, which has resulted in a great fiscal reckoning in our province. We just reported 2 weeks ago a $24 billion deficit, the largest per capita in Canada. And we are joined by Newfoundland and Labrador and Saskatchewan and other resource-producing provinces in facing a real crisis. And that is also why I am so grateful to my 12 colleagues from the provinces and territories across partisan and geographic lines for having stood with us and the people of Canada's resource-producing regions in calling for fiscal fairness through reform of the Fiscal Stabilization Program. I know most people have never heard of that, and it sounds like something from a policy textbook, but it was supposed to be a key part of the system that holds the country together. And Albertans have been keeping their end of that bargain. Albertans have contributed over $630 billion more to the rest of the country through their federal taxes over the past 5 decades than they've received back from Ottawa through benefits and transfers. And they are proud to have done so, proud even in recent tough years to have contributed $20 billion more than they receive back each and every year. So Alberta's been there for Canada. Alberta's been there to help build hospitals, fund health care from coast to coast. Now Canada has to be there for Alberta and for other provinces that are facing the greatest economic and fiscal challenge since the Depression. The language, I am so grateful to my colleagues for not having forgotten this fact. This was stated very clearly at the Council of the Federation meeting focused on these issues in December. It's restated here today. And so I just want to send a message to Albertans. I know many of us feel isolated, sometimes like the rest of the country doesn't hear us, doesn't care about the real human plight of what is happening in our province. But I want you to know that the other provinces and territories from coast to coast have our back, understand the role that we have played as nation builders, and are calling on the national government to do the same. Peut-être un petit mot français pour dire je suis ravi d'être ici pour exprimer la voix des Albertains en faveur de cet consensus unanime de toutes les provinces et territoires, de toutes les partis politiques et régions du pays, en faveur d'un nouveau marché, une entente entre le gouvernement fédéral et les provinces pour s'assurer une future du système de santé publique au Canada. Quand le système de santé canadien a été créé dans les années 60, le but était une division 50-50, un partenariat entre le gouvernement fédéral et les provinces, mais aujourd'hui, presque 80% des coûts de santé publique sont la responsabilité des gouvernements provinciaux qui sont de plus en plus en misère à trouver les ressources fiscales, particulièrement en Alberta. Et deuxièmement, j'aimerais remercier tous mes collègues, y compris le Premier ministre Legault et le Québec, d'avoir reconnu le besoin d'acuité, de justice dans la fédération au plan fiscal, dans l'appel unanime pour une réforme de programme de stabilisation fiscale qui va aider toutes les provinces, mais en particulier ceux et celles qui produisent les ressources naturelles. Merci.
Merci. On va débuter la période de questions. Vu le nombre important de journalistes présents ici et au téléphone, on vous demanderait de vous limiter à une question par journaliste. Since we have a lot of journalists present here today and on the phone, we will ask you to limit to one question per reporter. On va commencer avec le micro de droite.
Oui, bonjour, Laurence Martin de Radio-Canada. J'aurais une question pour vous, Monsieur Legault. À propos des transferts en santé, le gouvernement fédéral a accepté de vous rencontrer. Il dit être au courant de vos demandes. Je me demande donc, à quoi ça sert exactement ce que vous faites ici aujourd'hui?
D'abord, il faut poser une demande chiffrée. Ce qu'on demande, c'est que les transferts fédéraux passent de 42 milliards à 70 milliards l'année prochaine. Donc, qu'on passe de 22 à 35 du financement des dépenses totales en santé. Donc, un des objectifs aujourd'hui, c'était de dire on fixe des demandes chiffrées. Deuxièmement, ben oui, on veut une rencontre, mais on veut aussi des résultats pour le prochain budget. Donc, le prochain budget, la prochaine année financière, ça commence le 1er avril. Donc, il faut commencer maintenant les négociations pour avoir une nouvelle entente à long terme.
On va prendre la prochaine question.
Yes, this question for Premier Ford. It's Tonda McCharles from the Toronto Star.
Yes.
Hi. A little bit the same question that Premier Legault just got asked. You've presumably been able to transmit this message time and again in your weekly calls to the Prime Minister about how you need a greater federal infusion in healthcare. But I'm curious then, not only why are you here to do it in front of all of us and call a press conference, but if the federal government were to do something, say, like pharmacare, would that go any way to addressing any of your concerns?
Well, first of all, after a great meeting we've had almost every single week with all premiers across this province, we thought it'd be best that four of us came here and made our message very clear. Not just for one province, for all the people of Canada. Nothing is more important than health care. As I said earlier on, without health care, we don't have an economy. It goes hand in hand. Healthcare is number one, the highest priority. Once we have healthy people, then the economy starts moving forward. And I don't think we can be any clearer. And I don't want to point the finger at one government. We got to look at the system for the last 20 years, last 30 years. As the demand is growing, as Premier Pallister mentioned, the funding is going down. We cannot do it alone. There's no province out there that can do it alone. We can't have a budget of healthcare and debt. Basically, that's where we're going if we don't get healthcare in place and drive the economy, create new revenues to the coffers per se across all provinces. It's not sustainable when healthcare is growing at a 5 to 6% rate, and the federal funding from all governments, by the way, and I'm not pointing the finger at this government or the last governments, all governments combined, that have not put their fair share into funding. We're asking. I believe healthcare is a provincial issue, and I think all provinces feel the same way. Give us the money, and we'll deliver health care the most effective, most efficient way we believe what's going to be best for each jurisdiction, each province. But health care is the province's jurisdiction, and we all have our different needs. In Ontario, we need capital funding as well. There's some antiquated hospitals in Ontario. I went to a couple of hospitals that are still running a fax machine. We have to digitize everything throughout the healthcare system. But again, it's a provincial issue. We do need the federal financial support.
We'll take the next
Again, it's a provincial jurisdiction, and that's going to be up to each province to decide if we go down that route or we don't.
Next question.
Hi, Salima Shiv, GCBC. Not to belabor the point, but I want to go back to what Tonda said. Premier Kenney, you talked about this not being about politics, this is about people. Well, people are worried about infections rising and the virus being transmitted, and yet you guys have decided to come here in person to make this point when you have been holding, virtual meetings across, since the pandemic has started. Why was it necessary and to come here in person? And what do you say to people who see that as bad messaging, that you guys are traveling when then they are more worried about those cases rising in a lot of provinces?
Well, this couldn't be a more important issue. And we've had a lot of productive phone conversations, but this is a very high-profile, tangible way of emphasizing the importance of this issue. And by the way, governments have to continue to work, and we have to continue to work together. The federal parliament will be meeting next week to hear a speech from the throne, as they should, taking necessary precautions, just as all of us have done in traveling here. We're scrupulously following all of the Government of Ontario's public health guidelines and requirements. Government must continue to do the work of the people, even in the midst of a pandemic, do it safely. That's exactly what we're doing, to emphasize the top priorities of the Canadian people.
On va y aller avec Raymond Filion, TVA.
Oui, bonjour. Deux questions pour le Premier ministre Legault. Monsieur Legault, vous avez déjà discuté des questions de santé avec Monsieur Trudeau. Ce n'est pas nouveau comme enjeu, loin de là. Vous mesurez son ouverture comment? Est-ce que vous sentez qu'il est ouvert ou est-ce que vous êtes ici aujourd'hui en personne parce que vous sentez qu'il y a de la résistance? Et ma deuxième question, c'est alors que la seconde vague, selon toute vraisemblance, commence, souhaitez-vous voir le gouvernement fédéral prolonger ses programmes d'aide aux gens, comme par exemple la subvention salariale et la PCU?
Bon, commençons par les discussions que j'ai eues avec M. Trudeau. Effectivement, ça fait, comme certains de mes collègues le disaient, plusieurs années qu'on a des discussions sur le financement des soins de santé. Par contre, à chaque année, la situation s'empire. À chaque année, le pourcentage des dépenses financées par le gouvernement fédéral diminue. On a été déjà, quand ça a commencé, à 50 %, après c'était 40, 25, là on est rendu à 22 %. Et là, ça vient s'amplifier avec la COVID. On est obligé actuellement de prendre des infirmières qui sont dans les hôpitaux, puis les envoyer faire des tests et faire du traçage. Donc, ça retarde dans les hôpitaux. Puis dans tout ce que M. Trudeau a annoncé depuis 6 mois, il n'y a rien de récurrent. Nous, par exemple, on a embauché 10 000 préposés de plus dans nos CHSLD. Bien là, c'est bien beau, on a eu de l'aide pour cette année, mais qui, puis comment on va les financer l'année prochaine, ces 10 000 personnes de plus? Il faut ajouter aussi des infirmières. Ce que le plus important, ce sont les employés. Puis évidemment, les employés, ce sont des salaires, donc des salaires qui reviennent à chaque année. Donc, moi, je pense que c'est important là, de montrer qu'on est unanime. Même si on est 4 aujourd'hui, on est 13, on s'est assuré que c'est unanime la demande, puis la demande est chiffrée. On dit, on est raisonnable, même si le gouvernement fédéral reçoit 40 à 50 des impôts et taxes des Canadiens, on leur demande de contribuer à 35 d'un problème unique. Il n'y a pas une dépense, ni à Ottawa, ni dans les provinces, qui augmente de 5-6 par année. Ça n'existe pas, ça. Donc, on doit partager ce problème-là et on doit s'assurer que M. Trudeau, quand il va annoncer ses priorités dans son discours du trône la semaine prochaine, ne vienne pas inventer toutes sortes de nouveaux programmes puis de nouvelles dépenses, alors que la priorité des Canadiens, c'est de bien financer les soins de santé, puis actuellement, ils ne sont pas bien financés. Bon, concernant la PCU puis toutes les mesures de relance économique, il y a une question de dosage. On le sait, puis il y a beaucoup de PME qui l'ont dit au Québec. Actuellement, c'est difficile de recruter dans certains secteurs, même si le taux de chômage est élevé, des employés, parce qu'il y en a qui préfèrent recevoir le 2 000 par mois de la PCU plutôt que d'aller travailler. Donc, il faut être prudent. Oui, il y a des secteurs peut-être qui ont besoin de l'aide spéciale. On pense entre autres à toute l'hôtellerie, tout le tourisme, surtout dans les grandes villes, où là, bien, les emplois ne seront pas créés demain matin. Nous, on a le défi de requalifier ces gens-là dans des domaines plus porteurs, comme actuellement beaucoup de demandes dans les technologies de l'information, dans l'informatique. Donc, on veut requalifier ces gens-là. Puis encore là, il faut qu'il y ait un incitatif à aller travailler dans d'autres domaines. Donc, il faut qu'il y ait un équilibre dans les programmes de support à ceux qui sont à la maison.
On va prendre la prochaine question. Next question.
Hi, Premier. It's Tom Perry with CBC News. Can I get you to talk about what you're concerned about, what will happen if you don't see this increased investment from the federal government? And Premier Ford, you were talking about the long lineups we're seeing in Ontario for testing. Is that a result of a lack of investment by the federal government?
Well, again, I want to make this very clear. This isn't about going after, an orange party, green party, red party, or blue party. This is about talking about the concerns of all Canadians. And yes, we saw literally, and I'll speak for Ontario, as I stood up there month after month after month on a daily basis begging people to get tested, and I understand people are anxious, and it literally was from a Friday to a Monday, the lineups just right across the province increased. But the good news is we're ready. We're prepared. We have 3 mobile units that moved into Ottawa to take the load off the public system. The hospitals are increasing their hours. And I want to thank the frontline folks at the hospitals for doing that. We have the pharmacies coming on board, ramping up. Hopefully by this time next week, we'll have numerous pharmacies out there helping out the system. We have the asymptomatic folks that may be anxious or, they want to get tested, and God bless them. Get tested. But we're going to be prepared, and we're ramping up. And I can tell you, I am pushing the system like no one's ever pushed it in Ontario before. And I'm going to continue to push the system. The system is broken. We need to improve the system. And yes, do we need finances? Absolutely, we need finances to give the people on the front lines the tools that they need to get the job done.
Brian would like to follow up.
If I could just throw in, Tom, we've had this problem to a growing degree over a number of years. Because it's happened gradually, perhaps we didn't notice it so much. COVID makes it worse. It exacerbates an existing problem. We have conference board study that was done for us that shows that in every province across the country, the wait times have grown. 2 and 3 times the level they were 20 years ago. That was before COVID. Now we have hundreds of thousands of delayed treatments, diagnoses, surgeries that have yet to be performed. It is absolutely critical that we get this foundational part of our social structure repaired. And I would observe the question from the Star earlier regarding pharmacare. If your foundation of your house is beginning to crumble, do you redecorate the second floor sitting room? We need a federal government to focus on the fundamentals, the foundation, and the foundation of our healthcare system surely rests on our ability to get care when we need it in a timely manner. The federal government's contribution levels are the lowest they've been. The demand is the highest it's been prior to COVID. Now we have an opportunity to focus on fixing the system. This is what we must do as partners. The premiers have come together from every political party we represent, and there are many, unanimous on this. And we understand the problem because we're on the front line, as Doug alluded to, we're on the front line delivering care. We understand the pain that people feel when they wait because we get it. But we need the federal government now to respond as a partner should, step up, resume its rightful responsibilities on this important, critical issue.
Prochaine question, next question.
Glenn McGregor, CTV News. A question for Premier Kenney about equalization. You point out that the fiscal stabilization program is fairly opaque to most people. And so is your ask, I think, today, because I wonder if you could express it a little more in concrete terms. Sure. How much Alberta is entitled to now, and under the revised formula that you're proposing, how much are you looking for?
So fiscal stabilization was created decades ago so that basically when have provinces see a sudden economic collapse, the federal government will be there to soften the blow. I call it a kind of reverse equalization. Equalization is where provinces with higher incomes effectively share their wealth with other provinces. And for Alberta, that's meant basically 50 years of nonstop big contributions to the rest of the Federation. And we don't begrudge that. We're proud to have done it. We're proud to have played a country-building role, about $630 billion net contribution through equalization and other fiscal transfers. But now is our time of great need. We have seen our economy and our fiscal resources have just fallen off a cliff. 5 years of economic stagnation, plus the biggest decline in oil and gas prices in history, hitting us all at once. And so fiscal stabilization is supposed to be there for us. But about 20 years back, the federal government put a cap on it, $60 a person, which effectively means that under the program, we should be receiving, as a province, this year, for example, this year should be receiving $3.8 billion, and instead will receive $266 million. Over the last 5 years, we should have received $2.9 billion from fiscal stabilization. Instead, we received half a billion. So we've been shortchanged by about $6 billion. And look, I know that's just, it sounds like I just gave an accounting lesson here. The bottom line is we've got the second highest unemployment in Canada. We have an addictions crisis. We have a mental health crisis. We have a jobs crisis in a province that has been a magnet for people from across the country who came there from poverty and unemployment to opportunity and paid big into the rest of the country. And all we're asking for is that that be recognized in the way the system was supposed to be designed. And for a time like this, more than ever. So really, I call it a kind of reverse equalization, and it's there to soften the blow. We've made a kind of modified ask of the federal government based on to get a consensus across the country, which would change the technical parameters of the program so every province would receive something, additional support for healthcare and other key services through fiscal stabilization.
Prochaine question, next question.
Hi there, Dylan Robertson, Winnipeg Free Press. Hi, Premiers. You're asking for more infrastructure money, but a lot of the 10-year plan has not been spent yet. The PBO has talked about funding being shuffled around instead of duplicated to achieve, better roads and whatnot. I haven't seen provinces fast-track a lot of programs for the green stream, so I'm wondering how much of this is actually about there not being enough money if what's on the table isn't being tapped.
Maybe I can answer. We're asking for both. We're asking for more flexibility in the existing program and also faster answers, because right now we have many projects where we cannot get the share of the federal government. But on top of that, we're asking for an additional $10 billion a year of infrastructure.
We'll take a next question. Prochaine question.
This question's for the Premier. Doug Ford, welcome back to the Capitol, Doug.
Thank you.
Christine Zucchi from CTV News, Ottawa. So our Chief Medical Officer here in the City of Ottawa believes we are in a second wave. So your response to that, and how can we say that we are prepared for a second wave when we're quite literally seeing waves of people lined up at these testing centers, not able to get a test? And I do appreciate that we are working on that right now as urgently as we can to bring in mobile testing, but for a week now, we're hearing from families who've been turned away with sick kids, sick family members, not able to get a test.
Yeah, well, great question, and it's always great to be here in Ottawa. And one of the reasons, not to mention my three other colleagues here to be here, but I also came here to talk to Mayor Watson, talk to Dr. Edges, and I have a tremendous amount of respect for both of them, and listen to their concerns, because no one knows their cities better than the mayor and the chief medical officers. And as soon as they called out for help, we put 3 mobile units in place. We're working with the hospitals, ramping up their capacity. I feel Ontario, just over the last while, is ramped up testing. We're at 35,000 tests a day, and I'm pushing that system to hit 50,000. But again, they need the tools that we're giving them. But without the funding from the federal government, the funds are eventually going to run out. I want to get to 50, and then I want to ramp it up to the next level. I am absolutely laser focused on testing. We have a great team on tracking and tracing. We have Dr. Heyer and Matt Anderson, Ontario Health, laser focused. We have all 34 public health areas focused on it, and you'll see over the next little while. We're going to be ramping this up until we have pharmacies right across this province. You'll be able to walk into a pharmacy and get a test. And I want to give a shout out so far to Loblaws, corporate office of Shoppers Drug Mart, to McKesson, which owns Rexall and many other pharmacies. I want to give a shout out to Walmart that have literally stepped up, as we've been discussing this for a while with them, stepped up. And I get a message to everyone, especially, the government, our government, other governments. We cannot run at government speed. We have to run at COVID speed. If we're up against COVID, we can't be waiting weeks and months to make a decision that we've all seen, no matter if it's federal or provincial governments or municipal governments, how government runs. Those days are done. There's no more government speed. It's called COVID speed. You go full steam, you tackle it, and move forward. And I just have to compliment the 14.5 million people in Ontario. Everyone is pitched in. Everyone's pushing. We're all working together. We've put all political stripes to the side, not only in the province, but especially at the federal government. I've been up here for months complimenting the federal government for their actions, and I'll continue to compliment them. But we have to work collaboratively together, as we have in the past. And all we're asking, we need the money. We need the money to continue and sustain health care in this province. So we're confident that we're going to increase the testing to lead the entire country per capita. Jason and I would probably have a little friendly competition going on, but for a few months. But that's great. Isn't that great that we've all ramped up to make sure the testing is at par with the amount of people. And I kept saying, as a lot of folks have heard me, it's coming, it's coming. And to the small percentage of party goers out there, you know, you're hurting the rest of the province, you're hurting the rest of the country. And that's the reason we put in the largest fines in the entire country. It's not to target anyone except the people that want to have these massive parties in their backyard. And we're having a cabinet meeting. We're going to be rolling out other areas across the province. From the request of the mayors, I never make a decision without the mayors and the chief medical officers. And I listen to the medical experts. I always have, I always will. I'll base this on health and science all the way through. And I've been taking advice off Dr. Williams and our health team, and I'll always continue to take advice off the health and science folks.
So more parts of Ontario could have those rules?
Yes, they're coming. Because we've had requests from mayors and chief medical officers. I just don't believe in going in there as the big province. I believe in working collaboratively with the 444 municipalities, and they're calling for help. We're going to be there for them, and we're going to support them. And as we were with Mayor Watson and Dr. Edges, both great people.
We'll take next question.
Guillaume Saint-Pierre, Journal de Montréal. Justement, je voulais revenir sur cette question-là, M. Legault. Les cas d'infection augmentent partout au pays, donc Québec depuis plusieurs semaines maintenant. Ce matin, la directrice de la santé publique de la ville d'Ottawa a décrété qu'effectivement, on était dans une deuxième vague. Elle n'est pas à nos portes, on est bel et bien dedans. Est-ce que vous estimez que le Québec est dans une deuxième vague en ce moment? Qu'est-ce que ça changerait dans votre planification?
Bon, non. Selon notre santé publique, je pense aussi selon la santé publique de l'Ontario, on n'est pas dans une deuxième vague. Maintenant, il faut s'y préparer au cas où ça arriverait. Je suis content de voir, là, il y a eu une grosse compétition entre l'Ontario et l'Alberta pour le nombre de tests, mais aujourd'hui, au Québec, on a battu un record. On a fait plus de 29 000 tests hier, là. Donc, par capita, je pense que c'est un record. On va continuer à augmenter le nombre de tests, donc se préparer à une potentielle deuxième vague, mais selon la santé publique du Québec, on n'est pas dans une deuxième vague actuellement.
Il nous reste 2 questions avant de prendre les questions par téléphone. We have 2 questions left before going on the phone. Next question.
David Aiken, Global News. Good afternoon, Premiers. Question for Premier Legault and Premier Ford.
Yes.
One specific for Premier Legault. Today, New Brunswick and Saskatchewan joined to take the COVID app, the federal government's COVID alert app. Could you explain why Quebec is not really ready to proceed with that? And 2, this is for both premiers, long-term care facilities. If we have a second wave, can you talk to families about how you're prepared to make sure we don't have a repeat of what happened in the spring with long-term care facilities? If you could address that, Premiers Legault and Ford.
Regarding the app, we took a unanimous decision. So we are 4 different parties at the National Assembly in Quebec City, and all of us, we want to wait because there are some concerns about the protection of personal data. So that's why, but we don't say that we will not use it eventually. Regarding long-term care, we did many things. First, we hired 10,000 more people working in long-term care. We had a fast track for training. We also named a person responsible in each center of the prevention, management of the inventory of personal equipment, EPI, that's it. And of course, right now, all people in our centers, long-term centers, they wear masks, they wear the protection equipment. So, of course, and we can see that right now, the vast majority of the cases are in personal houses, not in those centers. So the situation is really under control right now in our long-term care facilities.
I'm sorry. With the long-term care, I'm going to use the Ottawa because we have an outbreak in Ottawa right now at West End. We've sent in the hospital, take over the long-term care, but the ownership of these long-term care companies, they have to take responsibility. And I'm calling out Extended Care. They have to take responsibility. They're a good company, but we want to make sure that the frontline healthcare workers are protected until they can protect the patients. It took one long-term care worker to go in there that was infected, and it went through there like an Australian bushfire. It's absolutely critical that the heroes, I call them the heroes, and mostly PSW workers, get tested, constantly being tested. And I've always said, and it's easy to sit back and talk about it, but we're going to put action to the words. PSWs in the province of Ontario are underpaid, overworked. And until we bring up the pay, which we're doing, because I'm all over health right now to get this through Treasury as soon as possible, we can attract more people. You know how tough it is? We have other areas within our province that I hear some people complaining. And I'm thinking, really? Why don't you suit up, be a PSW for a few days, go in there, see what they have to deal with, putting their community and long-term care ahead of themselves. That's what I call heroes. And doing it over and over and over again and getting underpaid. The system was broken for years, but I promise you one thing, and I promise the people of Ontario, we're going to take care of our PSWs. We're going to give them the tools to go in there. We're going to make sure that they have the PPEs. I'm going to make sure they have the N95 masks in there to protect them. Because it's my job to protect every single person in Ontario. And make sure a priority of the frontline healthcare workers are protected. And I just want to give you a message to PSWs. You're absolute champions. I love you. I've had an opportunity to sit down with leadership of PSWs yesterday. And we have their backs. And their comment from leadership, you're the first government, the first premier that's ever stood up for the PSWs. I'll always, always protect them. I see it firsthand. My mother-in-law is in long-term care home. My wife's there every single day supporting the frontline healthcare workers and taking care of her mother. She told me a story yesterday, and I saw her walking out, and I told the leadership PSWs yesterday, Carla had, my daughter, as Jason knows, makes cookies, right? Little guy cookies. Well, she's walking out with 3 boxes of cookies, big boxes. And I said, where are you going? She goes, I'm going up to see my mom, and I'm going to show my appreciation. This is for the day shift cookies, these are for the afternoon, and these are for the evenings. It seems small, but it shows appreciation. And when I went there, they all came outside, and the stories they told me are staggering. It's heartbreaking. Listening to these PSWs, a lot of them new Canadians, trying to put food on their table for their families, paying rent, in some cases paying a mortgage. But I'll never forget this one lady came up to me. She goes, I need more hours than 37 hours a week. And I thought, God bless you. She's working 37 hours and to provide, and she was a single mom, to provide for her family. If we could give her 60 hours, she'd take 60 hours. Because there's a lot of other people that aren't in that dangerous type of setting that aren't even willing to work 40 hours. They'd rather take the government money from the government. And then we have these other PSWs that are working their backs off and willing to stay and put literally, in some cases, their lives in jeopardy. And my heart breaks that we lost 6 PSWs throughout this pandemic. The hurt that their families must be going through. And all the people that may be complaining about their job, really? In the safe environments? Start looking at some of the other heroes that have been working their backs off to save our most vulnerable.
We'll take next question. Last question on the floor.
Yasmine Mehdi à Radio-Canada. Monsieur Ford, Monsieur Legault, je profite de votre passage dans la région pour vous poser une question sur la réalité transfrontalière entre Gatineau et Ottawa. On a entendu beaucoup de demandes d'uniformiser les restrictions avec le maire d'Ottawa qui s'inquiète de voir des Ontariens partir du côté du Québec pour profiter des règles peut-être un peu moins strictes. Est-ce qu'on envisage d'uniformiser pour Gatineau et Ottawa? Puis de quoi est-ce que ça aurait l'air exactement?
Bon, il y a un point, effectivement, qu'on a discuté, ça concerne les bars. Bon, du côté québécois, donc à Gatineau, notre règle au Québec, c'est d'avoir la moitié de la capacité du bar et que tout le monde porte un masque jusqu'au moment où ils soient assis. Puis quand ils sont assis, il faut qu'ils soient à 2 mètres les uns des autres. La règle en Ontario, c'est 50 personnes maximum dans un bar. C'est la seule différence parce que quand on regarde dans les maisons privées, c'est 10 personnes maximum au Québec et en Ontario. Donc, les autres règles, là, porter un masque dans les commerces, dans les transports en commun, c'est les mêmes règles. Donc, la règle qui est un peu différente, là, c'est la règle dans les bars où nous, c'est moitié de capacité, alors qu'en Ontario, c'est maximum 50. Donc, on est en train de regarder si on peut harmoniser, là, mais c'est quelque chose qu'on va regarder.
Les rassemblements intérieurs et tout ça. Puis, donc, là, il y a une différence parce que c'est ce que le maire d'Ottawa semble dire, en tout cas. Puis, si vous allez regarder l'uniformisation, ce serait donc seulement pour les bars, puis ça se ferait pour Ottawa et Gatineau. J'essaie aussi de voir de quoi ça aurait l'air.
Quand on regarde les maisons, autant en Ontario qu'au Québec, c'est maximum 10 personnes. Donc, ça, c'est clair. Il y a une exception, je pense aussi en Ontario et au Québec, pour les cinémas, les salles de spectacle. Jusqu'à temps que les personnes soient assises, c'est 2 mètres. Une fois qu'ils sont assises, nous, on a un maximum de 250. Mais, je reviens là, ce qu'on a discuté tous les deux, ça concerne seulement les bars.
On va passer aux questions par téléphone. We'll take questions on the phone. Operator?
Thank you. Please press star 1 at this time if you have a question. The first question is from Émilie Bergeron, agence QMI. La parole est à vous.
Oui, bonjour. Ma question est pour M. Legault et aussi les autres premiers ministres qui voudront répondre. La hausse des transferts en santé, on le sait, ça a déjà été dit, c'est pas une première fois que c'est demandé. Le discours du trône, maintenant, c'est écrit dans des termes assez généraux. Si vous ne retrouvez pas ce 35 %-là, qu'est-ce que vous allez faire? Quel genre de formulation vous satisferait?
Bien, écoutez, il faut tenir compte du fait qu'il y a un gouvernement minoritaire. Bon, j'en ai parlé avec M. O'Toole lundi. On a une situation où on a 13 premiers ministres des provinces et territoires qui demandent tous la même chose, c'est-à-dire que l'année prochaine, au lieu d'avoir 42 milliards en transfert en santé, qu'on ait 70 milliards de dollars de transfert en santé, donc une augmentation de 28 milliards, donc passer d'un financement de 22 % à 35 %, ce qui est raisonnable quand on sait que le gouvernement fédéral reçoit entre 40 et 50 % des impôts et des taxes des Canadiens et que c'est la seule dépense, la dépense de santé, qui augmente à une croissance astronomique, là, le double de la croissance normale qui est autour de 2-3 %. On parle plus de 5-6 % de croissance. Donc, évidemment, là, puis le premier ministre d'Ontario le disait tantôt, si on veut être capable d'embaucher plus de personnel, si on veut être capable d'être plus attirant, attractif, entre autres pour les infirmières, il va falloir augmenter les salaires, mais tout ça, ce sont des dépenses récurrentes et on a besoin d'une contribution plus équitable du gouvernement fédéral, puis c'est une demande qui est unanime des provinces. On a demandé une rencontre individuelle avec M. Trudeau, puis on a demandé que cette entente soit signée au plus tard lors de la présentation du prochain budget, donc le budget qui va commencer le 1er avril 2021.
Prochaine question.
Thank you. The next question is from Lucas Mayer from Newstalk 1010 Toronto. Please go ahead.
Merci beaucoup et bonne journée tout le monde. Hi everyone, and Shana Tova for those celebrating. Premier Ford, it sounds like you got your, as you said this week, ducks in a row on asymptomatic testing at pharmacies. But what is the status on the fall preparedness plan that's being worked on that many people are waiting to see? And also, we've been speaking with a number of concerned business owners in bars and taverns who say that insurance companies are either jacking up their rates or in some cases won't insure them at all because of the uncertainty around COVID. We heard from one who called their MPP, their MP, and they really haven't gotten any answers. So what's the deal with both the actual preparedness plan and if there's anything the province can do on insurance?
Well, the fall preparedness plan will be rolling out, I believe, next week. We want to make sure we cross the T's, dot the I's. But in saying that, Lucas, we're putting action into place, no matter if it's increasing the testing capacity, working with the pharmacies, putting mobile units and hotspots throughout the province, making sure that we react immediately when the mayors and chief medical officers are asking us to lower the numbers of social gatherings from 50 down to 10, from 100 outside down to 25. As for the restaurant owners, there's probably no area that's been hurt more than restaurateurs, and these are not all, but a lot of them are family run. A lot of them have been around for 25, 50 years. Everyone has their favorite restaurant, myself included in Etobicoke. We have some great restaurant folks. They need support. And these big insurance companies making tons and tons of money, they need to step up. And that falls under the Minister of Finance. I know he's been in communications with all the insurance companies. But this is the time the insurance companies need to step up like everyone else has. They need to step up and start supporting. Rather than running for the hills and saying we aren't going to give anyone insurance, it's your turn to step up, because guess what, to the insurance companies? You've been making hundreds of millions and billions of dollars over the years off the backs of the hardworking people. Now it's your turn to stand up. So we're on to it, Lucas. I promise you that.
We have time for 2 more questions on the phone. Next question.
Thank you. The next question is from Hélène Buzetti-Le Devoir. La parole est à vous.
Oui, bonjour. Ma question est pour Monsieur Legault et Monsieur Ford. Mr. Ford, if you need me to translate afterwards, just ask. J'aimerais revenir à la question de ma collègue de CBC plutôt sur votre présence en personne ici et le message que ça envoie aux citoyens à qui vous demandez ces temps-ci de faire plus attention. Monsieur Kenney nous a dit tout à l'heure que vous respectez la distance et les consignes, mais c'est exactement ce que Yves-François Blanchette nous disait quand il faisait sa tournée du Québec, quand il a rencontré son caucus. Ça ne l'a pas empêché d'attraper le virus. Résultat, il est en isolement, ne pourra pas être à la rentrée du Parlement. J'aimerais savoir, faut-il repenser les activités des politiciens devant cette remontée des cas? Merci.
Oui. Bien, écoutez, je pense que c'est important là, de respecter, entre autres, 2 consignes. Porter le masque jusqu'à temps qu'on soit assis, puis quand on est assis, toujours être à 2 mètres des autres personnes. Je pense que ça, c'est important. Maintenant, pourquoi ça valait la peine de venir ici aujourd'hui? Parce que, justement, il y a un lien avec la COVID. Actuellement, les provinces et territoires ont besoin, de façon urgente, d'embaucher plus de personnel dans le réseau de la santé, puis d'augmenter les salaires dans le réseau de la santé, parce qu'il y a beaucoup de postes qui sont affichés, qui ne sont pas comblés. Puis actuellement, on n'a pas les ressources financières dans les provinces et territoires pour être capable de financer ces embauches-là, puis ces augmentations de salaire-là. Vous savez, au Québec, on est en négociation, là, puis c'est pas facile avec les infirmières, avec les préposés. Donc, on a besoin de l'aide du gouvernement fédéral. Puis là, bien, on a atteint comme une certaine limite, là. On est à 22 % seulement de contribution du gouvernement fédéral. Donc, il doit y avoir rapidement une augmentation pour qu'on puisse, parce qu'on travaille tous actuellement à un plan pour rétablir l'équilibre budgétaire sur un certain nombre d'années. Mais on a un problème qui est unique aux provinces, c'est l'augmentation exceptionnelle des coûts de santé à cause du vieillissement, à cause des nouvelles technologies, des nouveaux médicaments, qui est à 5-6 % par année. Donc, c'est urgent qu'on règle ce problème-là. On voulait montrer un front uni. On est 4 provinces ici, mais on représente les 13 provinces et territoires.
Well, first of all, thank you for the question. I will ask you to translate that, but I just got to tell the folks, I'm working real hard on my French. Actually, I had a French lesson today. I have 2 every single week because I really respect the Francophone community right across the country, but especially in Ontario, and I'm working very hard to pick up my French. But I
no worries. No worries. It's just that I didn't know if there were translation in the room. So I was just asking, how wise is it for you to be, you and all the other premiers, to be here physically present in Ottawa when we see Mr. O'Toole being in isolation waiting for a result, Mr. Blanchette, who got a positive result? What message does it send to the people watching, people who you are asking to be more careful these days? Thank you.
Well, throughout this whole process, as soon as we walked through that door of this hotel, we had our temperatures taken. Outside of this meeting here, we don't take our masks off. And there's a big difference of going into a hotel that's under management, under strict guidelines and protocols, which they have here, compared to holding a big party of 150 people that there's hugging and kissing and swinging off the trees and spitting and everything else. You know, as I said yesterday, some of those folks that hold the parties for 150 people, you know, they're a few fries short of a Happy Meal. I just, you know, I just don't understand these guys. So that's where we're focusing on. We're here as a voice of all premiers right across the great provinces and territories from coast to coast to coast of this great country. And this is not, I've said it about 4 times now, I can speak for myself and I'm sure the other premiers. This isn't about attacking a political party, a political leadership, because we've worked collaboratively with the federal government. This is about a system that's been broken for decades and decades. No matter if you're from the blue party or red party, we need to fix the system. And we can't be more clear than coming here and sending a message that we need to increase the health spending up to 35% and have a true partnership. And I'll give the feds another compliment that yes, they have been to the table. Every request that we've had, they've come to the table for the safe restart. And we appreciate it and we're grateful. Now we need their support on healthcare, because once we get the healthcare moving forward, we get the economy booming.
On va prendre une dernière question au téléphone. We'll take a last question on the phone, operator.
Thank you. The next question is from Cynthia Mulligan from City News. Please go ahead.
Hi, Premier. Ottawa, as you referenced, says that it is now in a second wave. Do you agree with that? Do you think the other hotspots areas are in second wave? And last night, British Columbia announced that it was rolling out a new testing tool where children just have to gargle and then spit something out. Is Ontario behind when it comes to starting up new methods of testing? Are there better methods that we should be exploring?
Well, I saw that as well, and as I always say, I was onto it like an 800-pound gorilla. As soon as I heard that, I've been onto it about the saliva testing, making sure that we have approvals from our health team, but also the federal folks at Health Canada, making sure everything is fine. As soon as I saw that, I went right to our team and I said, you know, I saw gargling with salt water, putting in. I think that's great for kids. I think it's great for everyone, and it makes it a lot easier than getting the swab up the nose. And we have some of the greatest medical minds anywhere in the country, of the leading research hospital, UHN. And Dr. Smith has been, this guy is, talk about champions. This Dr. Smith has been in there wearing 50 different hats, calling up, how can I help you, Doug? Can I do this? Can I do that? Long-term care. Now, you know, I can't ask for any more help than what Dr. Smith and other healthcare professionals need. But Cynthia, I am so laser focused on this testing. As you saw, the numbers back in March, we're struggling for 3,000. We're 35,000. We've done almost 3.5 million tests. We're doing close to 52% of all the tests, even with 38% of the population, 52% of all the tests right across the country. And I will not stop. I will be relentless on the system, onto the ministries right across the board, until we get a handle on this and we're up over 50,000. Then as soon as we hit 50,000, I'm not going to stop at 50,000. I'm just going to keep pushing the pedal and pushing the system to bring it up even further than 50,000. And what helps is when researchers, and I look at it, isn't that God bless the people of BC, because there's going to be certain items that we're going to come up with and we're going to share it across the country. When it came to PPEs, I said we'd never rely on a foreign government. We'll never rely on that guy Trump ever again to dictate to us what we should be wearing when it comes to PPE. And great news is we have enough PPE right now, surgical masks, gowns, hand sanitizer, N95s, that when my friends here need help, just the same, I want to remind everyone, when we were in desperate need, who are one of the provinces that came to our rescue? This guy standing right beside me, sitting beside me, sent over ventilators. That's another great story. We have 10,000 ventilators, but when we're in desperate need, that's what friends do. They step up, like Premier Kenney did, and sent us, I remember it was almost a truckload of PPE, sent us ventilators. Yeah, and we appreciate that, and we're very grateful. And that's why when people are hurting, we need to step up. Ontario needs to step up, help the people of Alberta, help the other areas that are even hurting more than we are. So that's what real collaboration is about, and we'll always have everyone's back. And I say that on every single call that we have. We'll always protect the smaller provinces and the territories. Will always, always have their back.
Merci beaucoup. Thank you.
Thank you.
Thank you. A few fries short of a Happy Meal. I've never heard that.